Hey lady, so I'm going to give you some exercises and I want you to start with piston breathing. I don't know if we've talked about this before, but it's not my idea. But basically the idea is when you breathe in, your diaphragm comes down, and if your pelvic floor is not also coming down, then there's a lot of pressure on your abdomen, which can be really hard on diastasis and hard on your pelvic floor. So basically the idea here is when you breathe in, your diaphragm goes down so that this area can expand and suck in some air. So this goes down, so your pelvic floor also needs to go down. So every time you breathe in, pelvic floor drops and relaxes. And every time you exhale, pelvic floor comes up, so you contract the pelvic floor a little bit. And the reason, again, I want you to do this is because it's easier on your diastasis. So just make sure that you're doing inhale, pelvic floor relaxes, exhale, pelvic floor contracts. Sometimes if you can't really feel it correctly, it might be a little bit easier to do it on hands and knees. So one of the things that's a little bit easier sometimes to feel whether your pelvic floor is doing it is if you relax your belly all the way down, which is really hard for people to do because it looks terrible. But relax your belly all the way down when you breathe in. Contract both your abdomen and your pelvic floor. So what I want you to get started on working there is being able to contract your pelvic floor with your transverse abdominis, that muscle that goes around here. So that should help. Do some breathing exercises with that so you can get your exhale, contract the pelvic floor kind of pattern going. So start out with that. Just do a couple of those as kind of like a warm up. And then here are some of the exercises that I want you to think about doing. So heel slide, you've probably seen this before, but basically, again, that with that breath, contract your TA and just slide your heel out. And every time I want you to work on that deep core contraction with every heel slide. So that's one. Then marching is another one. So again, with that breath, and those might quickly become too easy, but again, with your recent surgery, I wanted to give you a few easy ones, but really concentrate on that breath and contraction of that deep core when you do this. Okay, so those were two. If those become too easy, then I want you to start working on a modified dead bug. So the dead bug is basically this one. I think it will be too advanced maybe to start out with, but eventually I want you to be able to do a dead bug where you're doing this number right here. It's pretty tough, but what you can start doing if the heel slides and the marches are too easy is just add an arm to the heel slide. And what that does is it challenges that deep core a little bit more. So opposite arm, opposite leg goes out. And again, exhale and get that deep core and pelvic contraction. Another thing that you can do to practice things is just a pelvic tilt. So you take a breath. And that helps the pelvic floor contract while your abdomen is contracting. So those are some exercises. You can also do a bridge. This will help the glutes, and it's not exact area, but girl, it's all related. It helps. So you can just hold a bridge. I'm sure you're familiar with that. That can be another really good exercise. And another exercise that I want you to work on are hip exercises. So basically, again, with the breathing, put the breathing with it. I want you to concentrate on keeping this part of your body straight up. Don't lean forward or lean back, because the exercise gets easier if you lean back. So have your hips squared forward, and then do some leg raises like so on both sides, because hips and pelvic floor and all that stuff is connected. So those are some of the exercises that I thought you could start with. And then one of the things that I wanted to talk to you about is picking things up like Jackson. If you were to ever pick up Jackson or one of your other substantial children, I want you to think about something called blow before you go. Let me get a weight to demonstrate. Okay, so this is one of my janky weights. Let's say that you are going to pick up groceries, or Jackson, or Charlotte, or one of the other kiddos. Especially, I want you to think about doing a strategy called blow before you go. So basically, you're going to inhale and then exhale. Start a contraction with your pelvic floor and your TA before you pick up child or groceries or whatever it is. So again, you start the contraction, and when you feel your pelvic floor and your TA turn on and start contracting, that's when you pick the thing up. So that's the way that I pick up the child. And another thing I wanted to talk to you about is holding kids. So it's kind of hard to tell because you have a kid in front of you, but a lot of times moms end up holding like this. I'm exaggerating a little bit, but that basically, I don't know if you can see, but what that does is it makes this come apart, which puts pressure on your linea alba. So what I want you to think about doing is holding. This is what moms end up doing because it puts the weight basically on your hips. What I want you to think about doing is trying to hold like this. And what that does is it actually engages your core without putting pressure on your linea alba. So it's really hard to do. It's super hard to do. It's actually more work for your arms. However, it takes the pressure off your linea alba. And a lot of times, even for me, it takes the pressure off my pelvic floor too. So play around with it. You don't have to be neurotic about it, but just be aware of like how your standing and holding can affect that linea alba. Stop standing like this, which is what a lot of moms do, and start standing a little bit further like this. You can kind of see like this makes you pooch out and it puts pressure on the linea alba, whereas standing a little bit more forward with your butt out a little bit actually makes your deep core engage a little bit more. So it has to do work, but it's not putting, like, my linea alba isn't like bulging out when I do that. So again, you don't have to be neurotic, and it's not like there's one way to stand, but there is something to be said for, if you are aware of a tendency, it can help relieve pressure on your linea alba while that tissue is healing and coming back together. As far as reps go, I would start with 3 sets of 10. Do it once or twice a day and see how your core feels. I don't know if you've talked to your doctor about like near the incision point for the gallbladder removal. Like, I don't know how much soreness goes into like bad pain or like just muscle soreness because you're starting to work. So that's something that you should probably talk to your doctor about, because I don't know how you're gonna be able to evaluate whether, oh, this is good sore, this is bad sore, because I have no idea after gallbladder removal surgery. But I don't think those should irritate it too much, but just be careful. And yeah, if you have any questions, let me know. Good luck. I love you. I miss you.